My name is Angie Marano. I'm the Director of Administrative Services at the Health Center at Williams College. Welcome. Deb Flynn is my colleague. Deb is the Director of Medical Services, and she's going to spend some time talking with you about those services and others we offer at the college. The title of this, we're laughing, is called Caring from Afar. And so I guess you guys are the afar piece and we're the close-up piece. And I guess more than anything else, we want to tell you that providing care for these students, for your students, son, daughter, is the most important thing that we do. And we spend a lot of time and effort to ensure that we're doing everything we possibly can to make the environment comfortable and good for them. And we have an exceptional group of practitioners, as evidenced by the person to my right. We have something that's called an integrated health center. And that means that we have all the services under one roof that we're providing from a health and wellness perspective to your son or daughter. Medical services, counseling, and psychological services are under the same roof, as well as health education. Hi, oh no, welcome, come on in. Health education, and counseling and nutrition, counseling and services as well. So everyone in that building is dedicated to providing care and caring for your loved one. It's a small college, about a little over 2,000 students, but we are open 7 days a week. We are open from 8:30 in the morning until 8 p.m. at night on Monday, Tuesdays, and Thursdays. Wednesday we open at 10, give us a little bit of time to do staff education. We close at 8, and Fridays we close at 6 o'clock. Saturdays and Sundays we're open from 1 p.m. to 8 p.m. So there's a lot of hours and a lot of opportunities to access care. We ask that your son or daughter call us and make an appointment for care. It's faster, it's easier, we don't keep anybody waiting. And it helps us too, as we have introduced electronic record into the health system. This year, this freshman class is the first group that is going to experience it totally. All of their records will be online. And so it helps us move things along quite well. What happens after hours? We talked about being open and available 7 days a week. After hours, the same phone number, 2206, will take the student to a call prompt that will provide medical services or psych counseling services 24 hours a day, should that be necessary. So there is always someone at the other end of the phone to provide help and direction for the students. Okay? Hi. I think there's a few more. Let's just wait a second. Hi, come on in. I think there's air conditioning if we all are just very calm and don't move around. Right? We're good. There's another option that we have for students that has been very helpful to them. We live, you've noticed, in sort of a rural area. We have transportation available for our students that need to go to a medical, dental, counseling appointment. It's free of charge. They dial one number, 4545, and we'll make that transportation arrangement for them to or from. They may go for an x-ray, they may need to go for some dental exam, and those services are available throughout Berkshire County, which is where we are now, as well as Bennington County, which is the adjacent county just to the north of us in Vermont. I think just in the opportunity for one final piece of information, and that is, we're always a phone call away. Our first obligation is to the student. Hey, come on in. And we will always have that conversation with the student about their care. It's privileged and it's confidential. And if there is any information you'll have a tendency to maybe want to call us and, how's it going, how's it doing, how's my son or daughter doing. We have that conversation with the student. So if you do call, we really can't tell you if we've talked to your student, your son or daughter, or not, but we will reach out to your son or daughter and ask them to contact you, or ask them if they'd like us to share information with you. And that's how we work it at the health center.
Yes. Just say which hospital/health center you're affiliated with?
Glad to. We don't have any direct affiliation, but there are several area locations. The closest is Berkshire Healthcare System. They have a campus in North Adams where they have a full-service emergency room, as well as all the ancillary services we need, like radiology, X-ray, MRI, CT. They also have day surgery. In the event you have a minor procedure, they have a full operating room. We just don't have an inpatient facility. 14 miles to our north is a full-service hospital. It's Southwestern Vermont Healthcare. They're associated with Dartmouth Hitchcock. They have a full-service hospital. And of course, Berkshire Healthcare Systems in Pittsfield, of which the ER locally is affiliated with, is a wonderful full-service healthcare organization that has all the range of services, including psych services for us. That's a good question. Thank you so much.
And all our outpatient testing, lab work, x-rays is usually done through Berkshire Medical System. So that's probably the one that we work with the most
Absolutely.
closely.
With that, Deb Flynn.
Okay. Hi, everybody. So my name's Deborah Flynn. I'm a nurse practitioner, and I've been with the College Health Center now for 10 years. This is my second year as being the Director of Medical Services. The College Health Center is mostly staffed by, we have 2 full-time NPs and we have a part-time PA, and we're there from 9 to 5, Monday through Friday. In the afternoons from 3 to 5, the local physicians from Williamstown Medical Associates come over to help with kind of the overflow. So they're on site from 3 to 5 every day, Monday through Friday. They are also the physicians that your son or daughter will get if they call the after hours and need to speak to someone. They actually take the call for us as well, on weekends as well as evenings. We have a psychiatrist on staff who is currently there every day, Monday through Friday, from 8:30 to 1:30. And we have a multitude of psychologists and counselors for anyone's mental health needs. And there's multiple ways for students to access that, whether they come in and make the appointment themselves, whether they come see a provider, they're not sure what to do, they come talk to one of us and we can facilitate that referral and appointment getting booked. Some students actually just send an email saying they'd like an appointment with a counselor, and someone will call them and help them get that scheduled. So we're very proactive in getting anybody in to see a therapist who feels like they need that service. We also have a nutritionist who is there Tuesdays, Wednesdays, and Thursdays for any sort of health needs that the student would want, whether it's someone who's got a history of disordered eating, whether it's someone who's got diabetes or celiac disease or an allergy to certain foods and they just want more information, that's easily accessible as well. All these services that we provide as far as the providers, the physicians, the psychiatrists, the psychologists are free. We do not charge, we do not bill for our services. If your student comes in and we're concerned, maybe they have mono, we need to draw some lab work, that's where the insurance piece comes in, where that bill the lab will actually charge them. But as far as our services, they're not billed. So the student can come, as often as they feel like they need to and be seen. The weekends and the evenings are staffed by an RN. So from 5 to 8, and then the Saturdays and Sundays from 1 to 8, that is an RN. So she will basically triage the patients and decide, is this something that I can take care of right now? Is it a cold? Is it a sore throat? Is it a urinary tract infection? Is this something that needs to go to the ER? And if she decides it is, she can call the transport and have someone take the student to the emergency room. Or is this something that can wait until Monday and be booked with a provider? So there's multiple levels of care that she can provide. If she feels like, maybe this looks like a urinary tract infection, I need to have the student started on medication, she'll call one of the physicians or myself and get the orders to start medication. So there's a lot of levels there. We have a very small, limited pharmacy. So we can do 72-hour dispensing for certain medications, like urinary tract infections, strep throat. We can get the student started. And that will seg me into the next pathway here of, we work very closely with Rite Aid in Williamstown. They deliver prescriptions to us Monday through Friday. And these prescriptions can come from people's home physicians as well as from the health center. All Rite Aid wants is basically an account. So the student has to call, set up the account. They're going to want their insurance information, and they're going to want a debit or a credit card to build a copay. So if the prescription is sent in on a Monday, it would be delivered the next business day, so it would come that Tuesday. If there's something that we really feel urgent, say a student has pneumonia, and we really don't feel like we can have them wait. We'll work with getting that medication sooner. So we do have methods of making that quicker if we need to. The only medication that Rite Aid will not deliver is any controlled substances. So for the students who are on medication for ADD or ADHD, those medications are legally not allowed to be delivered. But there is a bus, there's a free bus that goes to Rite Aid. So that's something we can help the student as well manage that. I know Angie alluded to appointments. In the past, we had done, probably 50-50 walk-in versus appointment. And I think that unfortunately the electronic medical record is going to change that a little bit. So really, for the student's sake as well as for ours, have them book an appointment because we know they're busy. They've got a lot going on. The last thing they want to do is be sitting in the health center for 45 minutes waiting for somebody to get to them. That being said, anything of an urgent nature, a patient feels like they're having an allergic reaction, they just fell off their longboard and they're bleeding, we will always work in someone who's urgent. So it's, the regular routine kind of stuff, please have them call. We do have same-day appointments, so it's not like they're going to have to wait a week. They can get in that very same day and be seen. And we'll bend over backwards, to meet them where they are and get them the care that they need. If your student is really ill, say they call you and like, oh my God, I got 103 fever, I'm so exhausted, I can't even get out of bed. Security will transport the student to the health center. And the student can call and say, man, I gotta go. And the security will come pick them up and bring them to us. So that's a really nice benefit, especially in January when it's 30 below and no one feels like walking to the health center. And we get that. Allergy shots, we do allergy shots in our health center. We do them on Monday through Friday from 3 to 5. We usually do that during the physician hours, just in case anything, should happen. We want to have as many people there as we can. So we would ask the students to set that appointment up too. We do require that the first shot be given at home by the allergist. And the other thing, we do not do venom. So anybody who's doing venom shots, we don't administer those at the health center. Orders from outside physicians. A lot of kids are being seen for multiple different things and managed very closely at home. And lots of times physicians will send us orders to draw labs. We are more than willing to do that, and we will fax the results back to the home doc. So anybody student may fall into that, that's fine too. Specialty medications, there's some students who are on, Emerald or Humira meds that need to be refrigerated that are given, once a week, once every 2 weeks. We do have a refrigerator with a generator backup, so I do encourage students to have that medication delivered to the health center. And we'll store it. They can come in and give it, or if they need to be taught, we can certainly work with them on that as well. We do hold a flu clinic every year. That's going to be in October, and that's free of charge to the students as well. And that will be heavily advertised so that they'll know when to come in and get their flu shot. And we push it because we do see flu every year. And that is really all I had, but I figured most of you would have questions.
We're ready.
So bring it.
There was one thing, just to reiterate, Deb talked about we may send a student, they're concerned about to the ER for some follow-up. And, most likely, you all have been in ERs, that the discharge seems to be sometime after midnight. And that's another reason why the transport system is available. We actually operate it from midnight through 6 p.m. So the student your senator will always have a way to get back here. And we talk to those ERs and say, only if the student is going with their guardian can you release them. Otherwise, you're gonna make sure they get in the van and come back to us.
And back to your question about which hospital we use too. As far as Berkshire Medical Center, since we use their lab, we have an interface with them, and I can look up any information about a student who went to that ER so that we can provide better follow-up care. So that's a real nice benefit. Excuse me?
How far is it?
The local
North End?
satellite is about 15 to 20 minutes.
Oh, thanks.
About 4 or 5 miles.
Where is the health center?
The health center is at the very end of Hoxie Street.
Street behind us is Hoxie?
Yeah, all the way
The
down the
bottom
end
of the
on the far right. We're kind of tucked in back
It's
there.
about 3 blocks from the center campus.
Yeah.
If the student at some point in time wants the parent to discuss issues with you,
Yes.
is there a release form?
We actually, if a student tells us verbally, I want you to talk to my parent, or emails me
Okay.
that they want me to talk to their parent, I will be more than happy. We're more than happy to share information. I think that the main part that we just have to say is that these kids are legal adults. We have to get their permission before we talk. But plenty of parents call and want to speak with us, and that's great. So if you know, because lots of times the parent will call and say, I hear that, my son was diagnosed with this. So clearly the students talk to the parent. and we expect that, but they just have to say to us, yes, that's fine.
And you'll notate in the chart so that.
Exactly. We document in the chart that that's been approved. Yep.
I just want to know if this is at all typical. I read recently a recommendation that when students go away to college, you get a power of attorney and a healthcare directive in case, I don't know, something should happen and you need to make decisions for you. I mean, does anybody ever do that?
Did we have one? I would say,
We had one parent this summer contact us, and it wasn't a power of attorney, it was just the release of information. They wanted to automatically be notified if there was any untoward event with their child.
I mean, this recommendation was in the context of someone having a psychological breakdown and then, I don't know, needing to be
What would happen?
admitted or something.
So what would happen, so our confidentiality policy is, by the way, it's on health.williams.edu. It's a pretty good webpage. It does a better job than I did of talking about many of the things that we talked about here. But there are a few times that confidentiality doesn't hold with just the student. One is if we believe the student is at harm to themselves or others. If there is an untoward emergency event, we would typically, contact the dean. The dean would make the determination as to who to call. So we have that set up in our policy, and I'd be happy to have you take a look at it or talk about it later, but it does specifically lay out those things that we clearly do want to inform you about. And it goes the other way too. There are times, I'm certain, when you may want to reach your son or daughter and tell them something that's going on. And sometimes it's hard to find them because they don't, after typical kids that I know, they don't always call you back, or that cell phone doesn't ring for them. It's that number. You can always call the security offices. They're available 24 hours a day. 597-4444. They will get the message most likely to the dean, and then to the student.
Can you give me a summary of what facilities available in the Berkshire Medical Center? Because there's a big operation needed. Is that possible?
the Berkshire Medical Center that's down in Pittsfield is probably a 200 and some odd bed hospital, so multiple services. That's got a full ER.
They have
all
everything
sorts of specialists.
from cardiology to
cardiology,
psychiatry.
gastroenterology, neurology. The full boat. I can't think of anything that they wouldn't have off the top of my head.
Pittsfield is a little further away, right?
Pittsfield's about half an hour. I drive from Pittsfield, so
Okay.
it's not that bad a drive. It's right down 7. It's a straight shot.
Thank you. Sorry.
No, it's okay.
And the satellite office, it doesn't have an inpatient
In
North Adams, but it's got a lot of outpatient services, and we use that quite regularly.
Okay.
Because most of what we need can be done outpatient. But if a student needs to be admitted, then they will be.
Has the school had to use Pittsfield?
Yes. Yes, we have.
It's actually part of a health system. The big hospital, as Deb said, is in Pittsfield. It's a
Full,
And it's the
full
parent,
services.
company to that satellite office in North
Okay,
Adams.
I get it.
Yeah. So.
We've got just basic like dental care, vision care, eyeglasses,
Yep.
those kinds of things. Like, are there local?
There are, yeah. There's quite a few local dentists. I think 2 of them are within walking distance. There's eye care we work with all the time, especially if a student comes in with anything that we need to refer. They're so good. They'll see students really, really quickly for us if we need. But routine stuff, yes. There's optometrists and ophthalmologists in the area that are great. I've worked with them now for 10 years. I really like them.
Chiropractic by any chance?
Excuse me?
Chiropractic.
Oh, I'm sure there are. Yes, I know there are. I can't think of the name off the top of my head, but yes.
Them on Water Street.
Yeah,
Right, right, the local
exactly.
name.
Yeah, exactly. Yeah. And all those things would be, students need transportation. That's exactly what the van is for.
In those same lines, how about physical therapy?
Physical
like
therapy,
athletes?
Williamstown Physical Therapy is very close, like a mile and a half from us.
It's next to Rite Aid.
Yep, again, the van would transport, yep, so that's very close, we use them frequently, yep.
Where is the Rite Aid again that we need to set up an account?
It's on Route 2, so, yeah, on the left-hand side, it's probably about a mile and a half away. You can do it by phone. Yeah, if the
I would
student
say
calls and says,
you go out to the road here and you make a right. And about a mile of you on the left-hand side. I don't know routes from Adam. That's good.
and if the student just calls and says, I'm a Williams College student, and I need to have medication delivered, Rite Aid will walk them through the process. They're well versed in this. The good thing to know too, at the end of the year, they take all the students' information and shred it, and every year they start over. So they don't hold on to credit cards for long periods of time. They just, the school year, and then they start all over.
It's like health insurance. Every year you have to take an action to either accept or waive the health insurance, and every year, if you're interested, you have to sign up with Rite Aid for prescriptions. The third thing that came up a lot this summer, and if you remember this or not, doesn't matter, we'll remind you. We get a lot of questions, do we have to do the health form over again, or does our student need a physical again to come back for their sophomore year? No, you don't. We ask if you have any changes in health condition that we're notified, and we'll give that to our medical providers or counseling providers and put that in our record so that we're updated on that. But otherwise, there's not a requirement to submit another physical.
Is that true for sports as well, or is there something?
It is, the sports, if you're playing the same sport, like a varsity sport year after year after year, you do not have to have an updated record. But if you hadn't played in a year, they will require that you update the physical.
So if we didn't choose the Williams healthcare system because we have one at home that
Yep.
still works or whatever, does that change their access to the health center?
Absolutely not.
Okay.
Any questions?
Do you have any discussion groups or support groups related to any particular chronic conditions? Diabetes, one thing, but other things?
They haven't really, we really haven't done specific support groups surrounding a diagnosis. And part of the issue, I think, is because we're such a fairly small college, we don't have large numbers of any particular diagnosis. So at this point, no. But certainly if you have a student or anyone knows of somebody who, I would say, come talk to a provider and,
We'd be happy to.
sometimes if we know of another person and we say, let me go talk to this other student and see, and we can hook them up. And I've done that in the past. So, yeah.
Do you have your own ambulance service here, or do you rely on the hospital to come?
We have an independent ambulance service. It's called Village Ambulance. They actually provide our transport system as well that we talked about. And so we call 911. They are usually the first responder.
And actually, the transport van, when we have them, when we call them, they actually are staffed by EMTs. So if somebody calls them and they're unsure, geez, do I need an ambulance or do I need a transport van? They can actually make that call when they get there.
So if the student did sign up for the Williams Health Insurance, when or where do they get the card?
Blue Cross Blue Shield of Massachusetts provides the card directly, and it will be in their mailbox.
Oh, okay. Okay, perfect.
They told us they'd be there. They arrived this week, so
Oh, that's fine. I
we're
just
looking.
thought she had to be somewhere.
Okay, so the ambulance comes and picks them up from Williams, and they go off to wherever you guys have decided they're going. Is somebody from here check on them? If we're very far away, are they on their own, and if they're sick? Are we just...
If we know about it, say if the health center sends them, we definitely are
So you'll
involved.
monitor from here, and they'll be...
Yes, we can, like I said, we can look them up. I can track what they're doing live, actually.
They're so little.
I know.
And we get feedback.
And the hospitals, I mean, they know us and they know who to call. If they get taken off hours and we don't know, any heads up that we can get so that we can follow the student is appreciated. Hopefully that will come from the ER physician, but if you happen to know anything, you hear
And it's
anybody
off,
that can let us
and
know.
I'm sorry, we also receive, happens to be off hours, if there's an event that isn't
Yes.
related to the health center, we'll receive a report the
From
very
security.
next day from campus safety and
Security,
security. So we know that the student was transported, and then we'll follow.
So we'll be in the interim dealing directly with the hospital to get information on our children if they're in the hospital.
At the time?
At the time.
Yes.
Continuing on, is there a phone number or an email that you can send out the information or something like that?
I would say me, and I'm D. Flynn, D as in Debbie, Flynn, F-L-Y-N-N, @williams.edu.
And we do have it, when you leave, if you
Sure.
want to pick it up, a little information sheet, it's the yellow sheet that's at the bottom on the desk here. It has our phone numbers and names. We didn't put email addresses.
Like, how does a year usually go? Like, just give us kind of an average year, like, how many kids end up in a hospital, how many kids end up, just, what's your average year?
What's our average year? The good news is, we don't see a lot of kids admitted. I think the most of the admissions that we see might surround psychological issues more so than real medical issues. We do see some ER trips, but again, if we can see the student and we feel comfortable seeing the student, we do that. I think sometimes it's the weekends when the student is sick and they just, want to get better. They have class Monday, so sometimes they'll choose to go to the emergency room, which is perfectly fine.
As opposed to coming to you?
As opposed to, yes, as opposed to waiting till Monday to come with us.
I see.
I usually would encourage them to at least start with a nurse, because sometimes, that will, first of all, that will get us in the loop and we'll know, okay, so they went, let's follow up on them. Every year's a little different. There's always a rhythm, and it really surrounds, what virus is out there now and whatnot. But we're very busy. The students do use us frequently and consistently, and they come in for any questions or concerns that they have, and we encourage that.
That's good.
I think that's we'll bend over backwards for them, and we're willing to, answer any questions that they have and work with them.
Our healthcare, go ahead.
If they are ill on a weekend, and so do they have access to a nurse via phone, or how would that work if they don't want to choose the option of the emergency room?
The nurse is there from 1 to 8 on Saturday and Sunday, and she has access to the physician or myself if she needs to talk it through or is not sure what to do with the student or anything like that. So she's always got backup as well. And then the student can talk to Williamstown Medical, the physicians themselves, if they feel like they're getting worse or.
What do you recommend students do if they have concerns about a friend, a classmate, around alcohol, drugs, or mental health issues?
Come talk to us. Lots of times the students will come just to have a sounding board, how do I do this? Especially we see this a bit around eating disorders. The students will have a conversation with one of the providers or one of the psychologists. I'm really worried about this person. I'm not sure how to bring this up. If I bring this up, this person's going to be really mad at me. And so we always encourage anybody that feels like they're stressed trying to help another student to come talk to somebody at the health center.
And we've told their JAs the same thing.
Yes.
Many of you have met the junior advisors that are assigned to each entry. The same thing, to come and talk to us. No one's in this alone. There's lots of backup and lots of people that can help. We just need to know about it.
My kid has psychiatric needs, and they will not come to talk to you.
Right.
How can you figure that out? Or other than just her classmates or his classmates to talk with you individually, behind her or him? Any other ways you can figure out my kid may have psychiatric?
Well, sometimes it comes through the dean's office. Sometimes if a student happens to be struggling in class and it comes through the dean's office if the student is struggling and we have a name, it's always really difficult because due to confidentiality, we can't force someone to come in. But we can certainly work as a team, and which is what we try and do, to encourage the student to come in. And whether the student comes in for a medical need, lots of times psychological issues will present with medical issues. And we can have a long discussion with the best, how to best manage this. Obviously, some people have barriers to their own rationale behind receiving psychological counseling services. But we try and work through that. We offer them, even sometimes I've done, just meet this person for 20 minutes. This does not mean you need to do counseling on a regular basis. But you can at least kind of talk to somebody for a few minutes and see what you think. Does this work for you? Does this not work for you? And I've actually gotten students to follow through doing that.
It's a good question, because there are lots of other entries aside just from coming to talk to,
Right.
some people that a student might not want to talk to us. They want to talk to one of their peers. So we have a peer health program. We have a program called Let's Talk that is actually in Presky in the student union, 5 days a week, where you could drop in. You can talk to a counselor. It's actually one of our fellows. So they're pretty much near the age of the Williams student, they're available to talk. We have groups, we have support for our sports teams as well. So if you don't want to come to the health center and make an appointment or talk to a provider, maybe you do eventually, but the entry could be through one of the groups, one of the peer groups. Active Minds is a student-led organization here that deals with mental health and well-being. So we have lots of connections. It's just finding the one that's most comfortable for your student.
Actually, this might be something beyond your area. So how much does the church do? Is this a Christian church or like any kind of church? How much the church does in this regard?
The Congregational Church is multi-denominational.
Nice.
And we also obviously we work very closely, frankly, with our chaplain,
Yep.
Rick Spalding, chaplain of the college, and all of the chaplains that work with him. Also are another, I thank you for bringing it up, another avenue for students to reach out relative to, supporting their health and well-being.
And Rick does a lot of work with students who prefer to talk to him as opposed to a counselor.
Do they offer like the certain groups for like, different kinds of students?
The sex services does offer some groups. It changes on a yearly basis, and I have not heard what they're offering.
And the
this year.
chaplains do as well. They have
Yep.
something called Life Raft.
Yep, Life Raft is the choice.
Which is set up I think it's Thursday evenings at this point. It's always later in the evening. Students stay up later than, I can't stay up past 9 o'clock these days. I just admitted that. But so they're they may not feel comfortable. Davis Center is another place where certain students may be more comfortable talking with that group or someone in the Davis Center or in the chaplain's office or in our mental health services or our medical services. However they enter, our goal is to ensure that they are connected in the right place and getting what they want and need.
Do you guys communicate with the church?
Not directly. I'd actually have to ask probably Chaplain Spalding that question. I don't know. We do not. From the health center, we do not.
How much does the advisors do in this regard as well?
The JAs?
The advisors, like each student was assigned for
As a faculty advisor.
Before they came. Do they do anything in this regard as well?
They certainly can, and certainly could and would. In fact, our counselors meet with the faculty. We usually meet with the faculty in the first 3 years that they're here, and talk to them about the services that we can provide and support, because they want to know what they're seeing in the students as well, and what avenues they can reach out, and what's available to help the faculty help the students. So yes. The more places that we can touch, the better we're going to be able to serve the students. So the students in the center, and we try to surround them, so there's not just one place to go for to have a question answered, but many. Good questions, thank you.
Your staff, are they male, female, as far as your counseling staff?
The counseling staff, we have a mix of both.
Okay,
Yep.
great. So if a student prefers. then they can
Correct.
take-
Yep, they can certainly,
And it's a good question, and sometimes students don't click with the first counselor, but they don't feel comfortable with that conversation. The counselors fully expect it.
Yeah.
So if the first one doesn't work, we have, 10 or 11 other people that can fill in, male, female, a very diverse staff. Age group as well. They tend to be younger these days.
Does anybody else
Good
have any other
questions,
questions?
yeah. How you feeling?
Awesome.
Yeah, how's your mental, wait, your mental health? No, I'm just kidding.
Jealous, actually.
Yeah. I know, I want to go back to school.
I know. We have a lot.
Look up Williams Mystic program. The semester at sea, that's very exciting. Anyway, thank you all for coming today. We really appreciate it.
And the sheets up
Best of
here, the
luck.
health center in brief, so it kind of goes over, it stops, it's a lot, as you tell us.
Thank you very much.
You're welcome.
I know, it's